Hi, I'm Dr. William Lau. I'm a board-certified plastic surgeon in New York City. The purpose of this video is to give you information to prepare for the upcoming consultation. This video can also allow you to review the material that we will talk about at your own leisure. Double eyelid surgery is the most common performed surgery in Asia, and the purpose is to create a natural-looking fold right above the lash line. And this fold can make you look younger and also brighter. There are mainly two types of surgery for double eyelid that we do in our practice. One is called the incisional type, one is called the non-incisional type. And they both have pros and cons. There's no perfect procedure, and we do both quite often. First, we'll start with the non-incisional one. The non-incisional one means no cutting. So we just make 3 small needle hole incision and we bury a suture inside. The advantage is less trauma, so quicker recovery and no scar. The downside to the non-incisional method is there's a potential for thread loosening or the fold losing its control. Double eyelid is held by a piece of suture. If one day the suture breaks, then you can lose the hold. But that would be the worst scenario. If it happens, you can just resuture again. Or if you want to convert to the traditional incisional method, it's also very easy to do. The incisional method is literally we take a knife and we cut your eyelid and create a fold. The advantage of that technique, you can remove extra skin or extra fat, and the security of the double fold can be stronger. But of course, the recovery time is a little longer and you will get a permanent scar. The scar kind of fade over time, but sometimes in some people it can be obvious. And the recovery time, of course, is a little bit longer. So there's pros and cons of each. Typically, young patient, we recommend them to start with the non-incisional method. An older patient with a lot of extra skin or a lot of people with a lot of extra fat, then we'll recommend doing the incisional method. So the non-incisional method, because it's minimally invasive, so the surgery time usually take about between 15 minutes to 30 minutes, whereas the incisional method is a little bit more invasive. You have to cut, you have to sew, so typically it takes about 30 minutes to an hour. Non-incisional method, since there are just 3 small needle holes, there's really not much to do. We will recommend you to ice afterwards, about 15 to 20 minutes every hour whenever you're free for the first 3 days. And then we'll give you some antibiotic ointment to put on the incision side. But besides that, there's not much to do. The recovery is relatively quick. I would say you can look presentable in 1 to 2 weeks. But total swelling usually takes about 1 to 2 months to fade. Whereas the incisional method, typically there's a cut and a suturing, and then we'll put a cosmetic tape over the incision side. And this tape will stay on for a week. And we'll remove this tape at your 1-week follow-up. You can still open your eye and see everything normally, but there'll be a little small tape on top of your incision. And the recovery time is similar, I would say presentable 1 to 2 weeks. Total swelling goes down maybe 1 or 2 months.